Unfortunately, the word possessed comes to mind, that this child was doing so beautifully and then complete and overnight different child.
He was a completely different kid. It was looking at looking at a different kid in the same body.
There was no way that they could conceive of the possibility that he was not like that 2 weeks ago.
It's like a seizure. It's like watching your child be attacked by a ghost. It's the most out of the blue, random, intense overtaking that you could ever imagine. I don't really know what to relate it to.
PANDAS is distinguished from other kinds of obsessive compulsive disorder and tic disorders and eating disorders by the fact that there's an unusually abrupt onset of symptoms. It literally comes on overnight.
This organism causes so much havoc. I mean, there's 100,000 people die of strep infections just in the U.S. every year.
It's like he's looking up at me in desperation, like, Grandma, I don't understand this. Please make this stop.
Logan had elevated blood titers suggestive of a strep infection. He also had all of the acute markers associated with PANDAS in terms of his clinical picture.
Second bill, similar situation. It's House Bill 984. It's relative to insurance coverage for PANDAS and PANS. We're in a situation where young children are afflicted by a disease and insurance companies don't want to pay for the treatment. Let's look at IVIG. So I'm looking at a treatment protocol and procedure that is expensive. But if it works, how can we deny it? And ultimately, what's the long-term cost?
You know, the concept of putting $10,000 on your credit card, it sort of seems obscene. But then when you kind of let go of that and do it, you know.
Once you open up the floodgates, you feel like it doesn't matter anymore.
Yeah.
I think all of this was born, out of like the anger and the frustration of the denials. I think it was just a meaningful way to move forward with things.
Our insurance company said no. We had a team of specialists all advocating that this was the best treatment choice for our daughter, and the insurance company said no. We protested, we appealed twice. 4 months we went back and forth. Our studies, our experts, their experts. I mean, it's a system where the deck is really stacked against the family. Ultimately, the fate of our family really was shaped by an insurance company doctor, a doctor who doesn't treat patients, and a doctor who had never examined our daughter. We sat down and decided that if our team of doctors was saying that this was our daughter's chance, her chance for a life, that we're gonna give it to her. So we put our first treatment on a credit card. We started turning back the pages, we started seeing glimmers of our girl. We put on number 2. We happily slapped number 3 down onto the credit card, and within 6 months, we were $25,000 in the hole.
Between the antibiotics, IVIG, and therapy, you would not pick her out of a crowd. She's just a happy, typical kid.
We have our daughter back.
Yeah.